Hello everyone, and thank you for joining us today for this webinar where we'll discuss the costly impact of ineffective requirements management in the medical device industry. My name is Marie and I will be the host for today's webinar. Before we dive into the content, I have a few housekeeping items to share with you. So first, at the bottom of your screen are multiple application tools that you can use, but most of them are already displayed on your desktop. All those application tools are resizable and movable, so feel free to move them around to get the most out of your desktop space. If you think the slides are too small, you can expand your presentation area by using your pointer in the corner of the widget, or maximize it to full screen by clicking on the arrows in the top right corner. If you happen to have any issues with your audio or your video, you can find some answers in the help widget located at the bottom of your screen. Please note that next to the presentation area, we have a resource list available for you. You will find a copy of today's slide deck and links to resources around the topic of the discussion. Have a look and download everything that you may find useful. For those who want to rewatch the presentation or share it with a colleague, the webinar will be recorded and sent to the email that you registered with within 24 hours. And lastly, if you have any questions during the presentation, feel free to submit them through the Q&A widget. We are here to answer you live via the chat, so don't hesitate to reach out. And in case we run out of time or we didn't manage to answer you, we'll make sure to follow up later by email. So now that we covered those housekeeping items, let me introduce our speakers. So today the webinar will be co-hosted by two subject matter experts. We will have Sandra Rodriguez, who is a senior industry analyst at Axendia. She has 20 years of experience working within the FDA regulated industries in a variety of roles, including sales, marketing, and as an analyst for the past 6 years. She has contributed numerous articles to industry publications on the technology and regulatory trends that impact the futures of the life science industry. Sandra will be joined by Jama's medical and life science principal solutions lead, Stephen Meadows, who will be sharing his experience and unique perspective on the topic. So for those who don't know Jama software, just wanted to highlight that we are a trusted partner, as you can see. We're the leading solution for requirement, risk, and test management. So innovative companies use Jama Connect to improve quality, reduce rework, prove compliance, and get to market faster. Our goal for customers in medical device development industry is to free teams from document-based medical requirements management, streamline processes to improve outcomes, and spend more time on innovation. And based on Jama Connect's customers' most recent reviews in the G2 2022 Winter Grid report, we're proud and honored to be named the overall leader for requirements management software. You can see on the G2 grid that Jama Connect outranks IBM DoorsNext and Codebeamer, for example, for implementation time, adoption, return on investments, and market presence. So after this short intro about Jama Connect, I'm going to hand it over to Sandra, who will introduce Axendia and review the content of today's discussion.
Thank you for that introduction, Marie. And good morning, good afternoon, or good evening, depending on where you're joining us from today. Really quickly about Axendia, we were founded in 2005. Our headquarters are in Philadelphia, Pennsylvania. I'm physically located in San Juan, Puerto Rico, where it's a balmy 84 degrees today. What's unique about Axendia is that our analysts all have industry experience, and combined we average about 25 years of experience. We work with startup companies as well as Fortune 500 global clients. And we really focus on the intersection of the business, regulatory, and technology trends that impact the industry. So really looking forward to sharing the outcomes of our latest market research on the state of requirements management in the medical device industry. Just really quickly too, for the folks of you on the webinar today, congratulations. You will be the first to receive a copy of the research report. I'm not going to cover the report in its entirety today because we don't want to take away the thunder of it, but we do hope that you will find today's information valuable and timely, and that you get some great takeaways from the report. Before I go into that though, just a quick acknowledgement that the content of today has been sourced from our quantitative and qualitative research, as well as our interaction with FDA's officials and industry executives, and then some firsthand experiences from our clients as well. All right, so let's start with the demographics. We surveyed a multitude of companies from around the world, companies that perhaps make more than one type of medical device product. But here you can see that the majority do market and sell single-use disposable or consumable devices, followed by diagnostic devices that have both hardware and software components, and software is a medical device. So those were the top three. As a result of that, we wanted to look at the data in a little bit more, kind of slice it and dice it. So we specifically picked out software as a medical device. And you'll see in the report, and as well as in the presentation today, how the opinions vary based on the type of medical device company that we surveyed for this report. In addition, we got a good mix of small companies and large companies. The majority of the companies that did respond to the survey were under 50 million, so they could be startups, they could be a little bit pre-market, followed by the $1 billion to $5 billion size companies when it comes to their revenue. So another thing that we did was we went ahead and compared these survey responses based on those two different size companies. We also got a significant number of R&D and product development personnel to take the survey, which is important, right? These are what I call the boots on the ground, the companies that really understand requirements management inside and out. They're the ones who are working on the new products, as well as quality assurance personnel. And then we had a 17% representation of executive management. So another thing that you'll see in the report is that we went back to the data and did do some comparison and filtering based on these three personas, and we were really surprised to see how the attitude shifted. From a geographic standpoint, we had a really good representation. Overall, the majority of survey respondents do work for companies that sell and market products in North America, so Canada, the United States, and Mexico, followed by Europe and all the EU member states, and then of course Asia, South America, Africa, and Australia. So again, a really great representation of the medical device industry. All right, so this was our first question, and following the demographics, I think it's really important to point out that this was the first question that it came when it came to requirements management processes. We wanted to understand from the market standpoint if people felt that their organization's requirement management process was either effective, or I'm sorry, not effective, somewhat effective, very effective, or ideal. We were really surprised that when you combine not effective and somewhat effective, straight out the gate, we have a 68% of the market saying that there is a lot of room for improvement here. This is what I call aiming for average, and it's definitely time for this to change, because the complexity of the devices are changing. The regulatory landscape is changing, right? We have a lot more software as a medical device coming out there into the marketplace, and there's a lot of hardware and software components that are going into these products, whether you're doing remote monitoring of the products once they're out in the field or in the patient. So because of the complexity alone, you really need to have, you would want to see the very effective and ideal numbers go up, because when we combine them, we're only at 31%. And what's really shocking is that only 2% of those companies that we surveyed for this research project believe that they have an ideal process. All right. So we wanted to take a look at those numbers from the different personas. The quality personnel were of a little bit more positive. They believe that their requirements management process is very effective or ideal, right? So they account for about 53% of that. But when you look at the executive management, to have 87%, so almost 9 out of 10 executives indicating that their organization's requirement process is not effective or only somewhat effective, that's pretty shocking. keeping in mind that these are the folks that own the budgets, right? So if you know that there's a problem, we really need to do something, to incentivize these folks to make the necessary change and get to that very effective or ideal state. Even on the R&D and product development side, the same holds true, with 68% of those professionals saying that their organization's process is somewhat effective or not effective.